Hi, my name is Angela.
Hello.
I just washed my hands over here. What's your name?
My name is Colleen.
Colleen, it's nice to meet you. How are you doing today?
Good. Feeling good.
That's good. I want you to remember my name for later because I'm going to ask you at the end of it, okay? Alright, so today I'm going to do a head-to-toe assessment on you. So I'm going to first start off with a couple of questions. How old are you?
I'm 20 years old.
Alright, and do you know your height and weight?
I'm about 5'6" and roughly like 125 pounds.
Okay, I have a 20-year-old Caucasian female. She's well-developed, well-nourished, with a BMI of 20. Her grooming and hygiene appear to be all appropriate. Alright, now I'm going to ask you a couple of silly questions. I need you to tell me your full name, where you are, and the date.
My full name is Colleen Marie Bennett. We are in my kitchen right now, and today is July 29th.
Who was the president before Obama?
George W. Bush.
Alright, and what does the saying, "It's raining cats and dogs" mean?
It means it's raining really hard.
Alright, good. And if it's a hot and sunny day out, what would you wear?
Probably a dress.
Great, sounds good. From gathering all the info, I can tell that Colleen is alert and oriented ×3. Her general demeanor is cooperative. She's animated. She has articulate speech and a clear thought pattern. Her remote memory is intact, as well as her abstract thinking and judgment. Alright, now I'm going to take your vital signs here.
Okay.
Get your temperature here. So you know. Alright, good. 97.7. Alright, now I'm going to feel your pulse here. This one, like I'll use this one. Ease off.
The last thing to return is typically command. And it's often as far as 15 to 18 months off surgery before you finally see the command fully return to where it was beforehand. Ichi came back extremely quickly. He was only about 12 months off surgery. Probably wouldn't be in the big leagues if they didn't have the need created by Tim Hudson's injury. This may be what they have to go through with Ichi the rest of the way as he regains the feel that he had before his elbow.
It sounds like there's a need to add with for his pitches. You think they'll make a move to do that?
I don't think
Okay.
so. I think they believe
Your pulse was 70. Your respirations were 14. So that's good. And I'm going to take your blood pressure. That's what I do too. Just adjust it because sometimes it's in the week.
Runner was over 27 feet away from the bench, inside of 3, top 7. He's outside of 5, one arm for Ike Davis. Whipping it down to deep right, Marlon Burks goes all the way to first.
Marlon Burks should be headed elsewhere this week before the trade deadline. Would be a good workout for the
Alright, 110/60. That's good. Alright, are you experiencing any pain today?
No.
Alright, now I'm going to inspect your head. Have you had any vision changes lately? Abnormal headaches, pain, or anything else going on you worry about?
Nothing.
Okay, good. I'm going to feel your hair and scalp again. Okay. Do you wear contacts or glasses?
No.
Alright, I'm going to shine a light in your eyes. I just want to look at my nose. Okay, good. Now I want you to follow my finger, but don't move your head, okay? Okay, good. Let's see. Alright, now I'm going to check out your ears and nose. Do you have any trouble breathing? Or any trouble with hearing?
No.
That's good. Alright, and now I'm going to check out your mouth. I need you to say ah. Okay, good. Right, Colleen's head shows no infectious processes. All passages are clear. Her head is normal cephalic with appropriate textured hair with no lumps or lesions on the scalp. Her eyes are properly aligned and prominent with positive pearlas and positive EOMs and no nystagmus present. Her ears are symmetrical with no lumps or lesions. Gross hearing is intact. The nasal passages were clear with no drainage or no congestion or problems with hearing or smell. Oral pharynx is pink and moist and intact with no lesions, missing or loose teeth. Her teeth are appropriate, aligned and white, and there are no unusual odors coming from it. All right, now I'm going to examine your neck and skin now. Do you ever have any tenderness or pain in your neck at all? All right,
No.
I'm going to feel your lymph nodes now and let me know if you feel any pain, okay?
Okay.
Okay, can you swallow for me? Okay, good. I'm going to feel your trachea here. Alright. Let me just examine your shoulders and your back here really quick. Make sure everything looks alright. Okay, that looks good. Alright. Can I see your hands here? Okay, good. Her neck is supple with no adenopathy, no lesions and no JVD. The trachea is midline. There's no difficulty swallowing. The skin is of appropriate flesh tone with no lesions. She's the appropriate moisture and has a good warm temperature. And she also has good skin turgor. Alright, now I'm going to assess your heart. I'm just going to drop my stethoscope down your shirt here, okay, so you don't have to worry about undressing.
Okay. Very relaxing. Very relaxing.
Alright. Now I'm going to listen to your carotids really quick, so just hold your breath for a minute, okay? Okay, good. Alright, S1 and S2 are in appropriate relationship. The rate was consistent with all vital signs. The rhythm was regular and strong. There were no extra heart sounds or thrills, and there were no bruits present. Alright, now I want you to take a listen to your lungs. I want you to take deep breaths in through your nose and out through your mouth, but no quicker than normal, okay?
Okay.
Every time the stethoscope hits your chest. Good. That was the front. Alright, now I'm going to assess the back of your lungs, okay? So if you could just turn in your chair like that for me, that would be good. Okay, and then just turn to that side of the chair so I can see your back.
Oh, okay.
That's okay. Alright, now give yourself a little hug, and then bend your neck for me. Alright. Alright, you can put your neck back to normal if you like. Alright. Take a deep breath. Alright. Thank you very much. Alright, Colleen's rate is consistent with vital signs. Her rhythm is regular. The breathing was deep like I told her to do so. They were clear, even, and easy breathing. Negative use of accessories and no adventitious breath sounds. There are no lumps, lesions present on the skin, and the thorax is symmetrical with good excursion. Right now I'm going to inspect your stomach. First I'm going to listen to your stomach in one spot for a minute, okay?
Okay.
Good. Alright, now I'm going to percuss your stomach here for a minute, okay?
Okay.
Load up just a little bit more. Just like that. Alright. Alright, good. Now I'm going to feel your stomach with my hands here. Let me know if you feel any pain or tenderness, okay? Good. Alright, her abdomen is soft and non-tender. It is non-distended with normal active bowel sounds. in the 4 quadrants at a rate of 18. There's no organomegaly. There was negative masses or scars, and no guarding rigidity or rebound tenderness. Probably can. All right. Now, do you have any joint stiffness, pain, or any cracking of your joints when you move that you notice?
No.
Okay, good. Let me just look at your spine really quick now. I'm just going to feel it up and down. Okay. All right. So, Colleen's spine is properly aligned and has the appropriate S curvature. Her posture and range of motion appear to be appropriate with no joint pain, deformity, or crepitus. Alright, now I'm going to check out your arms and legs. We'll just feel them for the temperature really quick. Okay, just feel those then. Okay, that's good. And check your pulses now. You don't cross your legs? Thank you. Alright, let me check your fingers here now. What was the first thing you did for my toes? I felt my pulses. Yeah, I feel pulses.
Let me feel my pulses.
Extremities are appropriate and warm and dry. They are of the appropriate flesh tone. Extremities are symmetrical. Peripheral pulses bilaterally symmetrical, strong and regular, with brisk capillary refills, and there is negative cyanosis or edema present. Alright, lastly I'm going to test your strength and coordination. Could you stand up for me? Alright, I need you to squeeze my fingers. Alright, I need you to pull. I need you to push. Okay, good. Now touch your toes really quick for me. Alright, can you walk a straight line there and back? And back up. And then there you go. Walk a straight line and then back. Good. Okay, great. Alright, now hands out in front of you. I need you to push up and then down. Okay, good. Alright, you can take a seat. Every time I touch your toes or fingers, I need you to say touch, okay? Put your hands in your lap.
Touch, 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 touch.
And can you put your legs up for me? Alright, now push up against my resistance. Push down, and then go up. Alright, good. I'll test your reflexes really quick, okay? Alright, relax your muscles for me. Alright, good. Alright, Colleen has the appropriate muscle tone and bulk. Upper and lower body muscle groups are strong and coordinated with no focal weakness. The gait is appropriate. Sensory discrimination and deep tendon reflexes are grossly intact. And lastly, do you remember my name, Colleen?
Sorry, Angela.
Alright, her recent memory is intact as well.